Good afternoon, my good people. We are still measuring on our topic, which so many ladies or so many people have been waiting, especially ladies, because many of those who had requested this topic were ladies, because they are mostly the ones who are always exposed to these family planning methods. I'm not saying that men cannot have a family planning method, but mostly it is the ladies who suffer the consequences of using family planning methods. And before we continue, let me remind you, if you are there and you have not subscribed, subscribe to our channel so that as others benefit from it, you may be part and parcel of those who will be benefiting, and you will never regret later on, because many of you out there are appreciating, because the teachings they are getting there, if they apply them at home, some of them can work even without necessarily visiting the health facility. So let's continue with our topic. We are still looking at how contraception or birth control work. How does it work? We started with our first one in our previous video, whereby we talked about the lifestyle whereby we have the abstinence. That one can be used as a method of family planning. Let's look to the next one, which is the barrier. What do you understand by the word the barrier or barrier? A barrier method typically means that you use contraception as needed. Putting barrier is like blocking something. If I put a barrier on you, maybe I will block your way. From the layman's way of understanding. So, a barrier method typically means that you use contraception as needed. This means that you or your partner or partners are using something that goes into the body before sex to block sperm from fertilizing an egg. This means that you or your partner or partners are using something that goes into the body before sex to block sperm from fertilizing an egg. External or internal condoms or spermicides. These are some of the examples of barriers, which are external or internal condoms or spermicides. The third type, remember we are discussing about the common types of contraception, which or method or birth control method. The first one we said is the lifestyle control, whereby we have the abstinence. We have talked about the second one, which is the barrier, and now we have the hormonal. Hormonal birth control methods are often used on a regular basis. Hormonal birth control methods are often used on a regular basis. For example, birth control pills, the shot or the Provera, which many women like, which is always injected on the deltoid part of your hand. We have the ring or the intrauterine device, the IUD. Though IUDs, we always say they are non-hormonal, but they can be used as methods of family planning. So, on hormonal, we have, let me repeat this, hormonal birth control methods are often used on a regular basis. For example, birth control pill, the short, which is the Depo-Provera, the ring and patch, the short, Depo-Provera, birth control pill, the ring and patch. We have intrauterine devices, which are non-hormonal IUDs, or what we call copper T, are another kind of hormonal birth control. Although one form of IUD, the copper T, is non-hormonal. Let me clarify this point. Some of these IUDs or intrauterine devices can be hormonal and others can be non-hormonal. For example, the copper T. I hope now it's clear. Levels of hormones differ depending on the contraception. So the level of hormones will differ depending on the contraception used. They may stop ovaries from releasing eggs, thicken mucus around the cervix, or thin lining of the uterus. This is how these hormonal contraceptives control pregnancy by, number one, thickening the mucus around the cervix. This will be impossible for the sperm to penetrate. Thinning the lining of the uterus. Implantation will be impossible. Preventing the ovary from releasing the egg. Number four, we have the medical way of birth control. This includes invasive procedures. Medical procedures, for example, vasectomy, which is for men, or tubal ligation for ladies, change the body and ultimately prevent it from fertilizing or getting pregnant. Medical procedures, for example, vasectomy or tubal ligation, change the body and ultimately prevent it from fertilizing or getting pregnant. Where do you start before making a decision on a family planning method? Where do you start? Where do you start? Or you just move out of your house and go to an hospital or a health facility and say, I want a Depo-Provera or the shot? Where do you start? Sit down. This is very important. Sit down and take some time for a little. Sit down and take some time for a little self-reflection to work through the following questions. Before you start any family planning, sit down and take some time for a little self-reflection to work through the following questions. Number one, how reliable do you need your birth control to be? How reliable do you need your birth control to be? What level of pregnancy risk are you comfortable with? How reliable do you need your birth control to be? Or in other words, what level of pregnancy risk are you comfortable with? Number two, do you want your birth control to reduce STI transmission risk? Do you want your birth control to reduce STI or sexually transmitted infection transmission risk? Number three, what budget are you working with? What budget are you working with? Or how much does this family planning method cost? Number four, do you want children in the future? These are the questions you ask yourself. Do you want children in the future? How about the new future? Number five, are you trying to manage other symptoms? Are you trying to manage other symptoms? Number six, can you realistically use something on a schedule? Can you realistically use something on a schedule? Number nine, How do you feel about receiving a pelvic exam? How do you feel about receiving a pelvic exam? These questions are important, but worry not. These questions are very important, but you should not worry about them. Healthcare professional can give you the information you need to answer them. If you are anxious or nervous, these questions are important, but you should not worry about them, because the healthcare professionals can give you the information you need and to answer them if you are anxious or nervous. This marks the end of our video today. And for those who have not subscribed, let's continue subscribing and stay together as a family and make this channel grow bigger and bigger. Let's meet in the next video tomorrow.